What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering some of the common questions nurses ask X-ray techs. So to give you context, I'm a night shift X-ray tech. I've been doing it for about 4 years, and my lady is a nurse. So I have some understanding of why they ask some of these questions, or if I don't, I ask my lady because she's a nurse. So depending on where you work, some of the nurses, but if they're more veteran nurses, they'll kind of already know. It's more the younger nurses that always come up to us, the techs, and will get asked questions. So some of the common ones, and you should always kind of have something prepared as far as like answers and stuff, of course, to make you look more professional, because ain't nothing look more embarrassing that they ask you something and you don't know, and they're like, well, you just push the button, Miguel. And we're like, yeah, but we do more than that. So I would say some of them ask about radiation, about scatter, and how they can be safe while we're exposing, and the 6 feet at an angle, always like that, or just get out the room while we do it, or let up to keep you safe if you have to be there charting and doing whatever the nurses have to do. Or they always ask, how fast will it take to get read, or will this get a report? So once again, depending on where you work at, how the rads work, you can kind of bat an answer. Ours, overnight, the online radiologists will read, but they are kind of slow. So, and some of the nurses, especially for like NG tubes or any tube placement, they'll ask about the report. And sometimes it will be in the report, but they just, because the report's kind of long of everything, sometimes you just do a little bit scrolling into a little, say, tube placement, incorrect spot, or advanced or whatever. So sometimes you yourself have to go into whichever pack system you have and look at the report, or kind of look like there, because sometimes it won't give an exact answer, or the nurses just weren't able to find it, because the pack systems versus whatever system your hospital uses, sometimes the way it transfers the report isn't always like, it is the same, but the way the format, it's kind of harder to find. I don't know, that's just what I've noticed. So some of the next questions we'll get is stat x-rays. They'll ask why when they call we don't go right away, and sometimes like at night shift there's only 2 of us. Sometimes like we have to explain, I'm like, there's only 2 of us, so if you call us and we're in the middle of an exam or we're in the middle of a trauma room, we're not just going to drop whatever we're doing mid-exam just to go to you, unless it's like something emergency like rapid response, or it's the actual trauma room. Like sometimes they don't understand, because some of the times they're like, we called you. I'm like, yeah, we already told you one time that we'll be there, we're just busy. So some of the nurses don't understand that, because when you go to the hospital, there's hundreds of nurses. Like ours, during the daytime, there's probably like 500 nurses that run the joint, and then at nighttime, probably you can cut it in half, probably will run it. And some of them don't know that there's only 2 X-ray techs, or however staffing is at night, and there's only 1 CAT scan where I work. So they don't understand until more of the veteran techs, like nurses, will understand, and they'll kind of chill and back off. So, or they don't understand, sometimes their level of stat does not hold the same power as a rapid response stat or a x-ray order stat in the trauma room or in the emergency room. For their simple, sometimes they want it stat because just the simple the doctor or whatever just wants to report on it, and you're like, you gotta, like, they don't understand. So certain floors in the hospital, the nurses will order, like for instance, NICU in our hospital likes their exams done at 5 a.m. because that's what time they put the morning port order in. So that's the only floor we have at our hospital that we try to cater to the babies at that time, because they ask us all the time, can you please come at this time? And like, we'll tell them, like, look, we'll try to come at 5 a.m. It could be before, it can be later. It all depends, because like they just think we choose just to make them mad and come at different times. Like Like, there's a lot of other variables that go involved. Because I've noticed out of all the other floors in the hospital, NICU is in their own little world. Because, like, they don't deal with whatever stuff happens on the rest of the hospital. They're on their own little bubble. That's what I've seen. But, some of the other questions we'll get is how many X-rays we do, or they'll be interested to look at the pictures while we do them. Which obviously, if it more for nurses, like, it's fine, they can look at it. We just can't say it's broken. Ain't nothing make us more mad. Then they look at it and they say, "Oh, it's broken." And then the nurse or the patient looks at us and we're like, "Look, we can't say nothing. Like, a doctor gotta say it." And then, like, if they say it's broken and then they look at the patient and tell them, then it throws everything really bad, because then they start to worry and then we can't get a better, like, good image. It's kind of rough on us. So. Another question they'll ask, especially overnight, is if the patient has to be NPO for certain fluoroscopy procedures. Certain procedures they have to be NPO, certain procedures they don't. That's something I've noticed that they'll ask. Or they'll have questions about the gastrographing and stuff like that, as far as, like, if they're allergic to contrast and stuff like that. But that mainly allergic to contrast comes more into play for CAT scan. Or, I mean, we do too have to be aware in the fluoroscopy, but not so much for, like, just overnight, just doing X-rays and stuff like that. That's mainly for the main. That kind of everything I have to say about that. But yeah, it's been your boy Miguel. I give you all the knowledge I have in this beautiful floor of radiology, and I literally cover various aspects of this beloved field. And yeah, it's been your boy Miguel. See you on the next one.